Good morning, El Paso. This is Mary Jane Abelihi from New Station Shadow Health, El Paso, Texas. GNUR 3420. Today there have been a medication recall on Vioxx. Vioxx was once a popular medication that is being used to treat arthritis. Manufacturer Merck & Co. pulled this medication out of the market in 2004 due to some safety issues. This medication has been linked to thousands of fatal heart attacks or heart failures. Before this medication was removed, it has killed over 100,000 of Americans. I can imagine how devastating this can be for a medication that was supposed to be therapeutic to the patient and has been shown to end up killing them or causing such devastating event.
It's scary. It looks dangerous.
Pretty creepy.
Yeah.
This event that this medication has caused a lot of disheartening experiences from the heart of not just the people, the victims that are involved in this kind of effect, but also in the heart of the manufacturers and also the people that have approved this medication.
Hi, hello. What brings you in today?
Hey, I was here to be seen about some pain that I've been having in my hands over the last couple months.
Oh no. Okay. Can I have your name?
It's gonna be Pablo Escobar.
Pablo Escobar. Okay. Let me pull up your insurance. And were you referred by a different doctor?
Yes.
Oh. Okay. So I have everything. They'll be right with you. Okay. Thank you. Pablo Escobar.
Yes.
All right. So go ahead and follow me, and then we'll get into your room. Escobar, how are you?
I'm in a little bit of pain today.
I'm so sorry to hear that. So I'm here to take your vital signs. My name is Michelle. I'm going to go ahead and give the vitals to your nurse so you can see what's going on, all right? So you can just give me your arm really quick. Awesome. So your blood pressure is actually 143/86. Going to go ahead and take your temperature. Awesome. So your temperature is actually 98.7. Your respirations look to be about 22. And your pulse is a little bit elevated. It's at 103. Are they normal? Are they normal?
Yeah.
Well, he does have some things elevated. His blood pressure is a little elevated as well as his pulse. I'll go ahead and let his nurse know, and then I'll be right back, okay?
Okay, thank you.
Thank you.
Evelyn, how are you? Good, and yourself? Pretty good. I actually just got the vitals for Mr. Escobar.
Okay.
His BP was 143/86. His temperature was 98.7.
Okay.
His respiration rate was 22.
Okay.
And his pulse was 103.
Oh wow. Okay. All right. I'll go ahead and take a look at him. Okay.
Awesome. Sounds
Thank
good.
you.
Bye.
Hi, Mr. Escobar. My name's Evelyn. I'm going to be your nurse today. What brings you in today?
I've been having some swelling and pain in my hands and wrists for
Okay.
the past couple months. It's been making doing daily activities a little more difficult.
Okay. And right now, on a scale from 1 to 10, what would you say your pain rating is?
Right now, maybe like a 4 out of 10, but if I try to use my hands, it shoots up to like about a 6 out of 10.
Okay. So you said that when you move your hands?
Yes.
Okay. All right. How long have you been experiencing this?
Probably say maybe like 2 or 3 months now.
3 months. Okay. And is there anything that you do that makes it feel better?
I'm just kind of put it in some ice, or like some cool water helps.
Some ice?
Some ibuprofen sometimes.
Some ibuprofen? Okay. Are you a smoker?
I used to.
You used to smoke? How long ago did you?
Maybe I stopped like about 2 years ago.
Okay. All right. And is in your family, do you guys have any chronic diseases like hypertension, diabetes, arthritis?
My uncle had arthritis on
Your
my
uncle?
mother's side.
Okay. Anything else? Any high blood pressure or anything?
I think one of my aunts on my father's side had some high blood pressure.
Okay. All right. Do you have any allergies?
No.
No allergies.
No allergies.
Okay. All right. So then let me go ahead and speak to the nurse practitioner. All right. Hi, Mariana. So I have a report for patient Pablo Escobar,
Okay.
a 65-year-old male. Right now, he came in today because he's been having some pain in his joints in his hands. He says it's a 4 out of 10. When he tries moving his hands, it's 6 out of 10. He says that on his family, there's a history of arthritis. His uncle on his mom's side, He says that he's been experiencing this for 3 months. He says that he puts his hands in ice and he takes ibuprofen. It kind of helps. Blood pressure was 143/86, temperature 98.7, respirations 22, and heart rate was 103. He does have a history of smoking. He stopped 2 years ago. No known drug allergies or no known allergies. That's it.
Okay. Alright. Thank you for telling me. I'm gonna go ahead and put an order in for the x-ray of the hands.
Okay.
And then we're gonna do some blood tests. Put an order for a blood test, the CBC, let's do the rheumatoid factor, and the anti-nuclear antibody.
All right, sounds good.
Okay. Alright, thank you.
How are you again?
Hello.
All right, so the doctor went ahead and ordered some lab work, okay? What that means is I'm gonna go ahead and drop some blood just to see that everything's okay, all right? Awesome. Loves. And how are you doing today, ma'am? Everything okay?
Yes, I'm just worried about him. He
I'm
has
so sorry.
this problem with his hands. It's been like 3 months and it barely came.
No, and I'll go ahead and tell your nurses your concern. We're gonna see what we can do, all right?
Guys, my name's Maria. I'm gonna go ahead and take an x-ray, okay? Can I have you step out real quick while I take an x-ray of his hands?
Okay, yes, sure.
Yes? Okay,
I'll be back.
awesome. All right, so I'm gonna go ahead and take an x-ray on your hands. Can you go ahead and spread them out for me? All right. There we go. All right, I'm gonna go ahead and show this to your nurse practitioner, okay?
Okay.
Hi. Hey, Mariana. So I got the results back on his blood test, and then I also got the x-ray here. If you want to go ahead and look at it.
Okay. And for the blood test, what?
So for the blood test, the only thing that was abnormal was the rheumatoid factor did come out positive, and so did the anti-nuclear antibody, and he had slight leukocytosis.
Okay. Alright. You can see the inflammation right there. I think what we're looking at is rheumatoid arthritis, but I'll go ahead and go talk to him.
All right, sounds
Thank you so
good.
much.
Uh-huh.
Alright. Hello.
Hello.
How you guys doing?
I'm in some pain today.
Oh,
Yeah.
that's in
My
pain.
hands and wrists.
Okay. Are you able to move your wrist?
A little bit.
A little bit?
Kinda hurts
Clench
a
your
little.
fingers?
It's
Make a
really
ball?
uncomfortable.
Okay. You can't open doors or anything like that?
I've been having a lot of difficulty with that lately.
Difficulty? Okay. Alright, well my name is Mariana Gomez. I'm the nurse practitioner here. I'm just gonna go ahead and explain some stuff to you, give you some information, okay?
Okay.
Do you have any questions before we start?
No.
No? Okay, so we took a look at the blood test. There was some elevation on a couple things. We also looked at the x-ray. There is inflammation on the x-ray around the joints of your hands. And so we're gonna go ahead and diagnose you with rheumatoid arthritis.
Can I ask you what is that?
So rheumatoid arthritis is an autoimmune condition, which is when your immune system, so your white blood cells, which normally protect the body, they enter the synovium, which is the thin lining between the joints,
Oh.
and that's what causes it. Your white blood cells see that as foreign. Like I said, they attack it. Unfortunately, that is the situation that's happening. And what's happening while you're feeling this inflammation and the pain is because it's attacking and also damaging, which is resulting in the inflammation and the pain. Okay, so yes. Usually this affects the wrists, the hands, the knees, symmetrically right now. Is it moving towards your knees? Is it just in your hands, your wrists?
Right now, I've just been noticing mostly my hands and wrists.
Mostly your hands and wrists, okay.
And I've read that you can get bone cancer. I read it in Google that he can get bone cancer.
So this is not cancerous, but it is uncurable. So, but it can be managed with treatment, which the nurse will go ahead and explain some of the treatments that you can do. Like I said, it's uncurable. Sometimes it's genetics. I know your uncle, you said, had it. It can be genetics.
Wait, but I'm his daughter. Can I get it?
There is a possibility. I think later on. How old are you?
I'm 20.
Okay, I think maybe later on, maybe when you're entering your 30s, you can go ahead and get blood work done. Go ahead and take those preventative measures.
Oh, okay.
Yes, because it is genetics. Just to let you know, if it's not treated, rheumatoid arthritis is a progressive condition. So inflammation can develop into other parts of the body, such as the heart, the lungs, the nerves. It can affect the nervous system, and it can possibly turn into long-term disability. Okay, so if you're able to open a door now, if untreated, you may not be able to open doors, drive your car, your motorcycle, things like that. Okay, let's see what else. Any questions for me so far?
No, I was just scared because he didn't want to come. He had that pain in his hands, but he just was nervous to come here and get a diagnosis.
Yeah, and I understand. Sometimes it starts off just as cramping, right? You don't think it's much, but when it turns into, having difficulty doing simple things such as opening a door, that's when it gets pretty serious. But like I said, although it's uncurable, I know that sounds scary as well, there is ways to make it easier, such as the treatment that we're gonna offer. All right, so I'm gonna go ahead and prescribe you 2 types of medications.
Well, I just had a question. I wanted to make sure it wasn't that Vioxx. I think it was for arthritis, but I saw a commercial about it getting recalled.
Yeah, it's very dangerous. I saw in the news.
Right, no, those are not the ones that we're gonna be prescribing Mr. Escobar today. Okay? So the 2 medications, one of them is to improve the mobility in the fingers, the hands, the wrist, and then the one is to reduce the symptoms, the pain, reduce the inflammation, like I said, around the joints. The 2 medications are called hydroxychloroquine and meloxicam, and we'll go ahead and send you to the pharmacist. She wrote a prescription already. She'll go ahead and explain the side effects and whatnot to you guys, okay? Okay. Any other questions that you guys want to ask me?
For the medications, is he gonna have to take them forever?
Like I said, this is an uncurable condition, and so these medications are just to manage the symptoms. Of course, as we progress forward, we'll go ahead and take a look. You'll have to be visiting us again, every once in a while. But yes, since this is a lifelong thing.
Yes, thank you.
Okay, you're welcome.
Thank you.
Thank you guys. Have a nice one.
Alright guys, I'm back. So the nurse said that you're diagnosed with rheumatoid arthritis. This is your prescription, so you can go ahead and take that to the pharmacy. Okay, and then they'll go ahead and fill it up for you. So I just want to recommend that you continue to exercise. Try to keep your weight at a good rate. Try not to overeat. Kind of keep it pretty good. And also you can continue with the ice packs, like you said that you were putting the ice packs, putting your hands in ice. Try not to do it too long. We don't want you to get frostbite. And of course you can also put hot packs on your hands. And then again, not too long. We don't want you to burn. Okay.
Okay. Yeah.
All right. So that's the only thing that I can tell you that you can do that doesn't include any of the drugs. Okay.
Yeah.
All right, guys. Thank you so much.
Thank
and you guys
you.
have a good day. Okay.
Thank you.
You too.
Hi, welcome. Your name?
Pablo Escobar?
Mr. Escobar, do you have your prescription?
Yes.
Awesome. Thank you so much. Do you have your ID and insurance, sir?
Yes.
Very good. That's you. Okay, Mr. Escobar, we've actually already got your meds ready. The nurse practitioner has prescribed for you hydroxychloroquine. You're going to take one of these a day. This is an anti-rheumatic. It's going to treat the immediate symptoms of your rheumatoid arthritis. That's what you were diagnosed with, correct?
Yes.
Okay, so with this, you want to take it with food or milk to minimize any upset stomach. Nausea is one of the symptoms associated with the medication. You can also have blurry vision, headache. But what your nurse practitioner really wants you to let us know is if you don't see an improvement in your symptoms in a couple of days, okay? This treatment can take up to 6 months to see a full effect, but you should be seeing some relief in your stiffness systematically within a couple of days. So that's this one. Meloxicam is your second medication. This is an NSAID, non-steroidal anti-inflammatory, okay? So this is gonna help you with a lot of the pain. It's gonna increase your mobility, which I'm sure you're struggling with. This is also just one a day. It's gonna be 5 milligram capsule. You can just drink it with a cup of water, but if you really need milk or food, you can take that as well. Same thing, nausea, dizziness, you're gonna wanna look out for those symptoms. We've already screened you for any impaired renal function. We've already scanned your medication regimen. You don't have any contraindicated medications. You really don't wanna take this medication with alcohol or additional NSAIDs. And as with any other medication, you wanna let us know if you pick up herbal supplements. If there's any unusual symptoms, we need to report those to the doctor right away, okay? I know that was a lot of information to download. You'll have access to it online. Do you have any questions for me?
No. Covered everything pretty well.
Okay, very good. Thank you for coming by, guys.